Hello and welcome to this webcast. My name is Chris Bundy and I'm a health psychologist. So I specialize in helping people with long-term conditions such as psoriasis, psoriatic arthritis, but to help them to live well and to manage any worries that they may have about dealing with what is really a complex health problem. I also provide training for healthcare practitioners, healthcare professionals, nurses and doctors, physiotherapists and others to help them to manage their patients who need support to self-manage well. So this recording is designed to help you to manage the threat to you and your health condition from the coronavirus. Try to find a quiet spot when you're listening to this webcast to focus on what I'm saying. And maybe, if possible, use headphones so that you can really tune in and listen carefully. The reason I say that is because when we're anxious, sometimes we half hear things or we misinterpret things. And that's normal. That's a normal reaction to being anxious about something, particularly a health condition. And so really focusing and listening in will reduce the possibility that you might mishear something that I'm saying. If we look at the first slide, it's focused on what you as an individual can do to reduce your risk of contracting or being affected by the coronavirus, COVID-19. Call these both things interchangeably, but it's the same thing. The first thing to say is that stress comes about really when three specific conditions merge. The first one is when an event is unpleasant, and there's no doubt that this is a very unpleasant thing that's happened to all of us. The second one is when it's unpredictable, and of course we were all caught on the hop. This wasn't really predicted. A few people, experts, had predicted it, but of course that didn't filter down to you and I. And then the second thing is when it's uncontrollable. And there are aspects of it that are completely uncontrollable, of course. But there are things that you can do to take some control and to control the things that you know you can manage, the things that you can control, and really to put worry aside about the things that you can't control. So let's try and focus on what you can do. The first thing is within your home, you can control who you meet. Even though postal delivery and other delivery people and possibly helpers might be coming to your home, you can control who comes into the home and you can limit contact with them. And this is really important because they will have met other people. But doing what you've been advised to do, which is to distance yourself, 2-meter distance, and wash your hands with anything that they give you. So if they hand over a parcel, for example, to wash your hands as soon as you've taken that parcel in the way that you've been advised to do. These are very positive actions that you can take to minimize any spread, or indeed to minimize spreading it to other people. The second thing that you can do is to take control over the way that you think about this threat, the way that you feel in relation to it, and the actions that you might take. So if we focus first of all on thinking. I've already said that when we're anxious, when we're worried, and we are all worried about this, it's normal to be worried. But it makes us half tune in to important messages, to half listen, or what we call selectively listen to aspects of health messages. So for example, when we're worried about something, we tune into messages on the television or in the newspapers and so on that confirm what we already think. So this makes us more anxious because we've only half listened to a message or half read a message, which is consistent with what we think. this leads to us jumping to conclusions and to thinking in extremes. So we need to manage this. Some of the ways that you might catch yourself doing this is if you do what we call black and white thinking, thinking that it's either one thing or another, the opposite. And an example of that might be, I must be more at risk because of my illness. Now, whilst that might be true for some people, it's not true for everyone. So not jumping from the I must be more at risk because of my illness and thinking I could be more at risk, but I might not be, is a way of overcoming that black and white thinking. The second of these, if you like, thought biases are called intrusive thoughts, where we might be just looking out of the window and listening to the children playing next door. But every now and again, a thought just pops into your mind that this is really serious. I mustn't be thinking about trivial things. I need to be thinking about serious things. And these intrusive thoughts can get out of control. The third one is catastrophizing. And really, it's a big word, but what it means is you worry about the things that you can't really control. So thinking, for example, it's an extension of black and white thinking. Thinking, oh, I'm the typical person who's more likely to get it than anyone else. It's just my luck. Those kinds of thought processes are really not very helpful. They all link together, and they are a form of biased thinking. So how do we manage this? Well, the most important thing that you can do is to recognize patterns and listen, tune into your thought processes and see if there are patterns of black and white thinking, catastrophizing, times where these intrusive thoughts are popping into your head. They're more likely to happen when you're lying in bed at night, unable to go to sleep, of course. But recognizing it is the first part of changing it. The second part is interrupt. Stop those processes. Do something, physically be active or divert your thoughts away from those unhelpful, intrusive or catastrophic thoughts. And replace. The third one is to replace it with an alternative. Distraction's really good. It can help. So listening to music, doing a puzzle of some sort, just interrupting those thought processes and trying to imagine a more neutral position. So the more neutral position that I gave you in relation to black and white thinking was in relation to I must be more at risk because of my illness. I said you may be in a category that's more at risk because of your illness, but you might not be. So that's the grey in between the black and the white. So those are the ways in which you can have some control over your thinking. Don't expect it to just change overnight. This is something you're going to have to work at. The second place that you can take control is over your feelings. I've already said, and it's really important to be reminded of this, that it is normal to feel worried, to feel frightened, or to be scared of things we don't know what's going to happen. But also recognizing that your feelings include your physical symptoms. How you feel when you're upset about something is your heart rate increases, and you might be more acutely aware of your heart rate, feeling it in your chest, whereas other times you wouldn't normally feel it. You might be feeling more tired than usual, but also what goes along with that tiredness is an inability to rest. So you feel sort of agitated, tired, a little bit wrung out, but agitated, not able to rest. And this can lead to poor sleep patterns, of course. I'll talk a bit more about that later on. But you also might get an upset stomach. You might find that you're going to the toilet more often, your bowels are looser than usual, or that you have headaches. All of these signs are just that, signs of being anxious. It all goes together with skewed thinking, biased thinking. They're all part of the same thing. It's a response to a threat, a health threat. You might feel you're not able to concentrate, whereas before you might have been able to settle down and read a book or read a chapter of a book. Now you might find that you're having to go back over the page a number of times. Just recognize that as being part of the anxiety as well. Be kind to yourself. Allow yourself to worry because it is normal. And try not to see it as your problem, but see it as a problem, a response to a threat, and not something about you. It's not a character flaw. Everybody's feeling in similar ways anxious about this threat. It's a challenge to all of us, really, isn't it? The third area around your feelings is your actions, and this is the one that I'd like to concentrate on a bit more. You may find that you are reaching for comfort foods more often. A little bit of that is okay, but just be aware that if more regularly you're going to the biscuit tin or that you are looking for sugary foods, because it is quite usual when people feel anxious about things to look for comfort foods to make them feel better. You might find if you're a smoker that you're smoking more than usual, or you might find that if you're a drinker, you're turning more to an extra glass of wine, an extra bottle of beer, just to take the edge off things. That's not helpful in the longer term. It might get you through a day, and of course I'm not claiming that just getting through the day isn't acceptable. It is. But it might be setting up behavior patterns that might be more difficult to break when all of this is over. You might find that staying in bed is more usual, that you're finding it difficult to get out of bed in the mornings, particularly if you're feeling more tired, or you might find that you're more inactive than you usually are. That's a bit of a warning sign as well. Even if you feel tired, try to get up at the same time. You might find that you're more irritable than usual, or somebody in your household might comment that you're more irritable than usual, more short-tempered. See this as part of a response to a threat as well. So how do we manage all of this? Well, the first thing is to recognize, as before, that you do have some control over your responses, that you can have control over some small aspects of this. Get up, get dressed, get moving. Keep it manageable. Try not to for this to be the time that you take on learning to play the piano or doing something big. But try and do the small things that make you feel that you have control over what's happening. So simple things like getting up, getting dressed, get moving, possibly dress as though you were expecting somebody to come to the house. Make a bit more of an effort. And that might make you feel that it's part of a normal day. Try and cut down on the drinking if it's at all possible. Maybe using substitutes. You will have ways of managing your drinking, I'm sure. Maybe this is not the time to stop completely doing anything, but cutting it down and keeping it manageable will make you feel like you have some control over the situation. In terms of eating, try and cut out processed foods as much as possible. Cook from scratch and try and eat healthily. This might be the time that you find you take back control over the things that you eat and the things that you cook. In terms of activity, keep moving. Do as much as you can. If it's possible, go up and down stairs. Maybe build that into your daily routine, that's your exercise, to go up and down stairs. Do as much as you can, but also I recognize that for some of you this may be difficult. Even chair exercises can be helpful. If you're able to look online and find some exercise programs, there'll be something to suit everyone's level, even if it's from people who are virtually chair-bound to people who can get outside in their garden and do some physical work. Pitch it at the level that's suitable for you, but build it into your daily routine. In relation to sleep, try and keep the best possible sleep habits. And these are: go to bed at a reasonable time, certainly before midnight. Try not to be on your phone, your tablet, the internet, or watch television for at least an hour before you go to bed. Try and keep your exposure to blue light to a minimum. Keep your bedroom as cool as possible. One of the advantages of the coronavirus and people not going out to work or to socialize is that the traffic levels have dropped, and so the noise outside is a lot less than usual. So maybe having your windows open to cool down your bedroom might be helpful. All of these things are good. If you find that you can't go to sleep and that you're lying in bed, try not to lie for longer than 20 minutes trying to get to sleep. If you find it's longer than 20 minutes, get up. Go to a different room. Do something different for 15 minutes, whether that's look at a newspaper or read a chapter of a book, and then go back to bed and try again. These are all good sleep hygiene habits that the insomnia experts tell us work. If you're wanting to manage your medication better than usual, and of course this is an ideal opportunity to get to grips with taking medicines as prescribed, it is really more important than ever that you take your medicines exactly as they're prescribed to offset any risk of a flare of any sort. If possible, pair taking your medication with something nice that you like doing or that you like eating. Build it into your routine. And have a look at a resource plan that I did for the Psoriasis Association. It may be helpful. It's very simple. It's just a daily diary, but it's effective at helping you to structure your day. The more structure you have in the day, the less likely there is time for you to just be thinking about things, overthinking things, and fretting about things.